Welcome. My name is Melissa Hagerstrom. I am the Associate Director of Undergraduate Recruitment for the Bouvé College of Health Sciences. I want to congratulate you on your admittance to Northeastern and Bouvé College. We're so excited that you've been admitted and that you're attending this session with us today. It's a beautiful day in Boston. I hope wherever you are, it's a beautiful day as well. And thank you so much for taking some time out of your Sunday afternoon to hear about Bouvé and all the wonderful opportunities that we have. Over the next 45 minutes, they're going to learn a lot about Bouvé. This is a really great opportunity to get a little bit more information about our college and hopefully answer some of the questions that you have pressing. We'll be joined by the Dean of Bouvé, Dr. Carmen Shepa. We have an academic advisor with us, Lance Faria. We have a co-op advisor, co-op coordinator, Jackie Diani, and we have a student with us too, Joan Marie Hattie. So we're all really excited to answer some of the questions you have. Please utilize the Q&A feature in Zoom, and we're going to get through as many questions as we can during the session. I am also going to share my contact information with you as well. So if we don't have time to answer any of your questions today, please don't hesitate to reach out to me. I'm more than happy to answer your questions through email, or we can set up a phone call if you'd like. And then also, please make sure you check out the virtual Welcome Day platform for upcoming webinars that will get a little bit more in depth about some of the things you hear today. There's some sessions about co-op, there's sessions about advising, there's sessions about asking current students questions. So there's a lot of opportunities to get more in depth and answer some of the questions that you might have. So with that said, I'm going to hand it over to Dean Shepa to give you an overview about Bouvé College.
Hello, everybody. It's great to be here. And as Melissa said, congratulations on your acceptance to Northeastern University and specifically to Bouvé College of Health Sciences. I'm Carmen Shepa, Dean of Bouvé College of Health Sciences. And let me just really quickly show my screen. And you should be seeing Bouvé College. I hope that's what you're seeing. And so let me say, first of all, that we're very excited to have the opportunity to help shape your path to leadership in the fields that you have chosen in healthcare, in the health sciences, whether it's research, innovation down the road, and certainly Bouvé is the place to do that. So let me start by saying that we are looking at health and wellness a little differently than the usual paradigm of healthcare and medicine, in that we are seeing Bouvé College as the place where you will have the opportunity to be a leader in shaping and driving the transformation of healthcare into health span. And by that, we mean prepare a graduate who will understand the individual as a whole, not just the sick and the sickness, but really thinking about advancing and prolonging the health of all of the individuals, despite of the presence of risk factors, chronic conditions, and disability. This is possible because of the opportunities that technology and data provide us, but certainly thinking about clinicians, practitioners, researchers, innovators in the healthcare and health sciences space, who really are committed and working closely with people, their families, their communities, very closely with them. There are two important aspects that we know about healthcare that we need to be very aware of, and those are the digital transformation of healthcare that we see nowadays in everything that we do, and certainly even much more so today, as well as personalized care. And that should be based on the intersection of biology, lifestyle, and environment. And let me just show you really quickly what we mean here.
Say hello to a new reality, where artificial intelligence meets personalized medicine. A place where digital health intersects with humanity. Welcome to the future of healthcare.
couldn't get past that. Sorry about that. So in the training that you will have, that you will be able to shape yourself as you consider the different options that you have at Bouvé College, not only within your majors, but in terms of combined majors, minors, and other opportunities, which I'll go into detail in a second. The digital transformation of healthcare, which is the basis of your education that we will provide, is one that is based on technology and data to enable as well as to empower personalized care and ultimately enhance health and well-being for all. We know now in terms of the apps that we use to understand our behavior, telehealth, telemedicine, all of these are elements that we cannot escape in not only being recipients of healthcare, but being providers as well. The college has 4 distinct areas that all together allow to understand health and well-being from cells to society. And by that we mean understanding basic science, drug discovery, drug delivery, all the way to patient care through nursing, through physical therapy, speech language pathology programs, all in the realm of clinical and rehabilitation sciences, all the way to population health, thinking about health policies and even law, and areas related to behavior, as we said, that influence not only the person, but all the areas where that person interacts at work, at home, in the workplace, at school, etc. And we do this in the college because we harness the power of Northeastern University in terms of being experiential education, experiential learning at all times, contextualized by real world settings, particularly by our clinicians who are licensed physicians who are bringing to the classroom what they are seeing day in, day out in their professions, and also providing all of you the opportunities to be immersed in that real world environment through clinical education, through service learning opportunities, as well as co-op and research. This is a little example here of some of our faculty in the college who lately have been looking at rehabilitation, contact tracing, public health related to the pandemic, understanding peer support, trauma, stress, schooling from home, thinking about the fields of pharmacy and mental health supports, which is so important. These are just some of the examples of the kinds of things and interactions that you would have with our faculty in the classroom, in the real world settings, as I mentioned, as well as in the laboratories and in the different places where our faculty are doing their research and asking critical questions to address important challenges in health. And more importantly, to provide important solutions to those challenges. So the programs, you know them well, you have been admitted to some of these, but certainly we have our bachelor's programs in nursing, health sciences, pharmaceutical sciences, speech language pathology and audiology, and the pathway to the PharmD program. We have a series of +1 pathways that would allow you to consider not only a 4-year bachelor's degree, whenever possible. That wouldn't be possible in a PharmD program, which is by nature a 6-year program, but every other program you would be able to have that option. And then we have combined majors, and you can see here the combined majors in business, administration, communication studies, data science, environmental engineering, linguistics, psychology, and sociology were considered and were developed in particular because these are part of the competencies that our students are thinking about, particularly in the pre-health, pre-med, pre-PA pathways, as well as a result of the digital transformation and personalization of care that I talked a little while ago. We also have many interdisciplinary minors. And let me just say that the combined majors, we offer some of them, but you can create your own combined major with whatever discipline you are interested in doing so. And we will work with you to be able to do that. In addition to your majors combined and combined majors, the minors are 4 to 5 courses, one of which tends to be in the major, that give you additional depth and breadth in specific areas that you will be interested. They tend to be primarily interdisciplinary, and by that we mean they are courses that they share courses across colleges. Interdisciplinary collaboration is key to all of what we do in Bouvé in terms of your education. And that's exactly what we are looking for when you interact also with faculty who are doing research, also thinking about interdisciplinarily or across disciplines, just like the healthcare is interprofessional with more than one profession at hand. We are also ensuring and fostering within the college and the university an environment that allows for diversity, equity, inclusion, and respect, where we all respect and engage with one another in the best way possible. Healthcare, as we know, requires that we understand the patient, the client, the consumer. The lived experiences that we bring to the table are very important, and that allows us by engaging with our students and faculty and staff from all different backgrounds, we start reducing the gap in race and ethnicity that we see in healthcare. The healthcare workforce tend to be primarily women, but more importantly, we have to make sure that regardless of our student body, we are looking for diversity and equity and inclusion so that we all as healthcare providers and healthcare researchers and innovators and leaders in the field of health sciences, we can ensure that we are addressing health disparities, inequities, and social justice as we see it in front of our eyes almost on a regular basis now. And we will have the opportunity as leaders, and you with your preparation will be able to advance and promote health equity for all. Ultimately, what we are interested in doing is giving you the opportunity to explore, to experience, to apply in whatever area you're interested in doing, regardless of your major. As we said, you will have an area of concentration, but you will have the opportunity for experience-driven learning, for internationally recognized faculty who are doing research locally, nationally, and globally, as well as the academic rigor accompanied by flexibility of your curriculum in an environment that is innovative and inclusive. So with that, I'll stop here and pass it back to Melissa and look forward to the conversation.
Great, thank you so much. If everyone, all the other panelists can come back on camera and off mute, I'm going to introduce everybody one by one, have them share a little bit about their role in Bouvé. First, I'm going to introduce Lance Faria. He is an academic advisor, and they provide really important resources and information to our students. So Lance, I'll let you explain a little bit about OSS.
Sure, thanks, Melissa. So like Melissa said, my name is Lance Faria, and I'm currently an academic advisor in the Office of Student Services. So the Office of Student Services is our one-stop advising office on campus, which you meet with the first time you come to campus at orientation all the way through graduation. So all students are assigned an academic advisor who works individually with you to achieve both your academic and career goals. And you meet really frequently with us to, figure out if things change and really track your progress. So as a first-year student, you meet with your advisor at orientation to welcome you to the university, as well as sort out all of your AP, IB transfer credit, and really help discuss what classes to take in the fall and moving forward. So after orientation, you meet frequently with us to discuss how to register for courses, choosing program plans, talking about how many co-ops you want to do, as well as discuss if you're interested in various +1 programs. We really help create a pathway for you to complete those, in addition to minors and combined majors, etc. So in addition to all this course planning that we do as advisors, we work really closely with your faculty members to ensure that you are succeeding using our FACT tool, which is our faculty advisor communication tool. So if you're struggling in a course, we provide academic coaching and we get you connected with tutors if you're struggling in your courses. In addition to that, we connect you to other resources on campus, such as the Global Experience Office to discuss study abroad opportunities, dialogues of civilization, maybe completing some global co-ops. A lot of our majors a lot of our students go into pre-health pathways like pre-med, pre-PA, pre-dental. So getting you connected with the pre-health advising office so you know the admissions requirements, what classes you need to take, and then coming back to us to fit that into your academic plan. Aside from that, we work closely with the Bouvé Fellows Program, which is a upper year peer mentoring program. So in your first year seminar course, you're going to have Bouvé Fellows who are upper year Bouvé students. And we work closely with them to make sure things are going well. You're liking your experience here in Bouvé and at Northeastern, as well as throwing some dinners and some events that, to really show that, it's going to be a good time here at Northeastern. Aside from that, we work with the Bouvé Living Learning community as well. We host various dinners and events, different leadership and professional development opportunities, and really creating a sense of community within Bouvé. So if you're interested in meeting other Bouvé students outside of classwork, we work closely with the LLC. So that is very, very cool as well. So I feel like those are the main things we do as advisors. But yeah, if you have any questions about advising, feel free to throw them in the Q&A. Feel free to reach out. And yeah, thanks for being here.
Thanks, Lance. I also will be hosting at the end of April an Ask a Bouvé Advisor session. So Lance will be joined by some of the other academic advisors in our Office of Student Services. So this is a great chance to hop on that session and ask some more specific questions before you start having your individualized meetings with advisors. So next, Jackie Biani, who is our Senior Cooperative Education Coordinator. If you can talk a little bit about co-op, that'd be great.
Great, thank you. I'd be happy to. Welcome everybody and congratulations for your acceptance to Northeastern. Hope to see many of you here in the fall. So co-op is a very unique and important part of the Northeastern experience. As you probably know, this is real world work experience where within your chosen academic major and profession, you get to go out and work and explore different areas within nursing, pharmacy, health sciences, public health. So it's a very important part of your exploration within your chosen profession. As part of the co-op program, I'm one of several dedicated co-op faculty members. So within each major, you will be working with someone like myself, and our job is to work with you individually for whether you do 1 or 2 co-ops. We meet with students one-on-one to help you secure a co-op position, apply for them, make sure that you are employed, and then support you throughout your co-op experience, as well as when you return to the university for your next academic semester, reflect on that experience, because the reflection is extremely important in terms of your professional development. We also teach a co-op, what we call preparation course. So before you're scheduled to go out on co-op, you would be in a seminar with your co-op faculty member, and we will help you develop that professional resume that you need, prepare to interview. We have a dedicated database within the university where employers post positions and they're seeking co-op students. And we work with students to prepare you to engage in that database and get you ready to apply and interview for positions. So this is a very supportive environment. You are not on your own. We're here with you to support you throughout. A couple quick things before I turn it back over to Melissa. When you're on co-op, you're working full-time, and that's usually 32 to 40 hours a week. So approximately those amount of hours per week. Students are generally paid during their co-ops, and you do not pay tuition for the period that you're on co-op. Occasionally a student will take maybe an online course during co-op, but really you're focused on being immersed in the workplace and is learning as much as you can about that healthcare setting that you're involved in. I think those were some of the questions that I saw I wanted to weave into my presentation. So I'm happy to answer any more questions. It's a high-level overview of co-op in 3 to 4 minutes, and I'm happy to take questions.
That's perfect. Thank you so much.
Okay.
And I know I'm sure there'll be a lot of co-op questions.
Okay.
And there also is on the 30th, I am co-hosting with the College of Science a co-op specific session about clinical related co-ops, specifically for students who are looking to go on to graduate programs. So if you have a lot of co-op specific questions, that is a great chance also to come back. And last but not least, Joan Marie, if you want to introduce yourself.
Hi, so I'm Joan Marie. I am a fourth-year health science major doing the +1 Masters in Public Health program. So I will graduate this year from my undergrad program, and I'm in some of my graduate level classes now, and then next year I'll be in all graduate classes and a full-time graduate student. I'm also pre-med. I did a lot of exploring though, so I do know a lot about the other paths and can speak to those also from my friends' experiences. Lance is laughing because he had to help me schedule a lot of things and go through a lot of different possibilities. I went on the London Dialogue of Civilizations with the program, which means that I traveled with 2 Northeastern professors and a group of Northeastern students to London one summer and took communications for the healthcare professions and comparative healthcare systems while I was there. And then we had a lot of field trips and things like that that were related to that. On campus, I'm a part of Peer Health Exchange, where we go into local high schools and teach health. I'm in American Medical Women's Association. I was a peer tutor last semester, which is offered on campus for students. It's free and it's by students who have taken the courses before, which I think is a really neat resource. I'm in Knitting Club. I am also a Bouvé Fellow. So I am a TA/mentor for the freshman intro course that Lance was talking about earlier. I do research on campus with a nurse practitioner. I went on co-op as a patient care technician at Beth Israel on a general med surg floor, which is where I decided I was actually pre-med. And I chose Northeastern for me mostly because of the co-op and the real world experience that I could get, but also because I really did love the people in the community here and could see myself being really happy in it.
That's great. Thank you so much. I think you mentioned so many different things, so I'll let that sink into all the attendees to see what types of questions they have. The first thing I really want to touch on is there's been a lot of questions about pre-med. So I don't know, Dean Shepard, I'll have you start and then probably Joan Marie and Lance can kind of chime in. But what would you say to students who are curious about how Bouvé would prepare students for that pre-med, pre-PA, the pre-programs who are looking to go to graduate school, especially since you, are a physician yourself?
Happy to talk about that. And indeed, the coursework is intended to fulfill the requirements for applying to medical school, for PA school, dental school, veterinary school, you name it. That's what we call it, the pre-health pathways. So the coursework will give all the foundation necessary for the basic courses as well as the applied courses. The health sciences major in particular is one that also has a very strong core in public health. Is also accredited by the colleges in education for public health, or CEPH, CEPH. And so that also gives students an additional opportunity. More, in addition to that, and you know, our students are very competitive. That's what really I meant to say. And I'm looking at Joan, and I'm sure she can talk about this in more detail. But the other piece is our experiential learning approach, because students are learning not only through co-op and the other courses that they take, where there is a lot of patient, client, consumer contact, which is really very important, particularly in PA. There are a number of hours in clinical phase, in person, or now, you know, telehealth virtual type approaches in contact with patients that is required for PA school. So that's another example. And finally, there is the research opportunity where our students, as part of their experiential learning, also get involved in research, not only in as part of their coursework, but they can continue working in different laboratories and with different faculty, not only within Bouvé, but across the university, so that they can get involved in asking critical questions, writing abstracts, presenting at scientific societies and at conferences, and having publications. And all of this will be happening during your time at Bouvé, for sure.
Joan Marie, is there anything you want to add?
No, I'm just looking at applications right now, and I know when I was applying, I was always like, they just pick the kids that do a lot to come to these panels, and they pick the kids that would look really competitive. But honestly, it builds up without you realizing it, and everybody here is involved in things that they really enjoy. And so because that's the norm, I feel like your list just keeps building. And I feel like I'm in a good spot to apply, and those co-ops and things like that do really help. And if you are doing 5 years instead of 4 years or things like that, a lot of people take gap years anyway, is what I've learned. And so you're kind of just interspersing that, and it helps avoid burnout and all of that when you're applying. So it definitely sets you up really well.
That's a really great point. And I'm not going to say to anyone, you know, like Joan Marie is not exceptional. She's just, this is what a Northeastern student looks like, but it is a good point. I think when we have students on the panels who are juniors and seniors, there's just so many opportunities to participate in so many things at Northeastern and in Bouvé that if you walked around campus and pulled any student over and said, can you like give me a rundown of everything you've been up to? It's a lot. No student at Northeastern is ever just like, I go to class and hang out in my dorm room. Like every student that I've ever interacted with at Northeastern is just so involved and excited to be part of different types of communities. And I think that's one of the really great benefits of how Northeastern's structured. You get the small college environment in Bouvé, but there's just so many opportunities in Northeastern as a whole. You know, like knitting club is something that Joan Marie wants to participate in. And if she's in a smaller group of people, there might not be the interest for a whole organization devoted to the interest of knitting. But, you know, if you're going to a large university, there's always students who are interested and engaged in the things that you want to participate in.
And just a quick thing, Melissa, we should also say that the acceptance rate for medical school for students in Bouvé is pretty high.
Last year was 79% of students who applied were admitted, and the national average was around 41%. So yeah, it's really strong. I think it's, and you will be one of those. It's, I think, due to the combination of our rigorous academics, students are just really well prepared with the clinical experiences, the research experiences, and then co-op just gives so many really great opportunities for students. Like Joan Marie's already interviewed several times. She's able to talk about herself. So when she sits down to interview for medical school, it's not the first time she's had to sell herself. Jackie, there's been quite a few questions about co-op. And I know you touched on these, but I just want to kind of go a little bit deeper. Can you talk a little bit about if co-op delays, how long it takes to graduate? Are you paying tuition? Are you paid on co-op? Are there global opportunities? I know some of the stuff you've already addressed, but I think because it's such a different experience than some other colleges are offering, I think there's a lot of confusion about how co-op works with the whole curriculum plan. Like, when are you going on co-op and how does that work with academics?
Sure. And just before I answer those, is to follow up with Joan Marie, in many of the co-op settings, students are working in a real world interprofessional experience. And I think that is extremely unique. So our nursing students are on units where there are physical therapists and pharmacists and physicians. And for Joan Marie, to have that experience and other students, it's quite unique. And so it's an extremely important part. And I didn't mention it earlier, and she just made me think of it. Each program has its own academic schedule, which, Lance and the folks in OSS, Office of Student Services, are experts at, and they can share with you. And co-op is scheduled within the curriculum. We have 4-year programs, we have 5-year programs. So you would, need to look at specifically health sciences. In nursing. We do require 2 6-month co-ops. You can graduate in 4 years. So in that case, it wouldn't extend your program. Some students opt to stay longer and do more co-op, but each program is slightly different. So I'm not going to be an expert at answer, across the board. It's not one size fits all. But I don't think you should look at it as delaying your graduation at all. For those co-op periods, Northeastern does not have students, they don't charge students, you don't pay tuition. Some co-op schools actually charge students for co-op experiences. Northeastern does not. Now, if you elect to take a course during your co-op, that may involve a fee, but that would be an optional usually kind of thing. During co-op, we don't charge tuition. Again, you're working full-time, you're immersed in the workplace. We want you to be there learning as much as you can. And generally students are taking classes. Melissa, I think I missed a third question.
There was a question about global
Oh,
co-op.
sure.
Yeah.
Yeah, there's lots of global opportunities at Northeastern. So, some students will do NUN, some will do a dialogue of civilization. In terms of global co-op, the co-op faculty like myself work with students who are interested in completing a global co-op, but we also have an office of folks dedicated to working with students who want to complete a global co-op experience, because as you can imagine, there's a lot involved to working or volunteering in another country, and visas and living, situations, and what kind of, healthcare, things you might need to do before you go there. So students have that option. Many of the co-ops globally are in community centers. I will say they're not your typical hospital kind of experience, just due to legal liability issues in other countries. But we do work with students who want to complete global co-ops, and those are kinds of things we plan in advance. So students usually talk to us, kind of early on about that.
And then the last question that's been popping up in here is about different affiliations with hospitals for co-op. So I think a lot of times when people think about clinicals, and that's maybe the closest thing a lot of students have as an example, there'll be like a direct relationship with the institution to a certain hospital. So how is our network? Are there certain places our students are always placed? And how does that relationship work?
Yeah, so the co-op is really, driven by the employers, and it's really exciting, particularly in Boston and Massachusetts. The employers are reaching out to us saying, we want to hire your pharmacy students into pharmacy tech positions. We want to hire health science students, nursing students into these roles. We don't have affiliation agreements because it's not a clinical academic receiving credit kind of experience. So we work with employers, and many of whom we've worked for going back before I worked at Northeastern a long time. These are long-standing relationships. So, in the Boston area, I think I can speak for all of the Bouvé programs. We work with every hospital in Boston: Children's Hospital, the Brigham and Women's Hospital, Massachusetts General Hospital, Beth Israel Deaconess, where Joan mentioned, Tufts Medical Center, Shriners Hospital for Children, Franciscan Children's Hospital. I'm going to forget some of them.
There's so
But
many.
all of these hospitals they're posting positions right now. Students are applying to begin their co-op in July. So it's an ongoing, we call it a partnership. They seek out our students to fill real positions that exist within the hospital. I want to mention two things. One is many students, once their co-op ends, are asked by the employer, would you like to stay on per diem? It's an optional experience. It's not required, but many students stay on, and they'll pick up a couple of shifts here and there around their academic schedule. So it ends up being a longer term relationship. And the other thing is the employers, this is co-op is it's a 6-month job interview, we say, in many of the majors. So many of our students, when they graduate, are offered full-time post-graduation employment because of that relationship and that work history that they have with those employers. So incredibly valuable.
Perfect. Thank you so much. There's so much you said in there. There's something that made a flag, but I totally forgot now. Co-op is just, I remember. One thing that people usually ask me too is about the difference between clinical and co-op. So if you're interested in any of the programs that do require clinicals, such as nursing or pharmacy, clinicals are completely separate from the co-op experiences. So you actually get to have both of those at Northeastern because like Jackie mentioned, co-op is a work experience and clinicals are an academic experience. So you really get to have both of those, which is a really unique thing to Northeastern. So I just wanted to mention that.
Exactly.
Sorry, thank you. So we have about 7 minutes left. So I just want to make sure everyone gets the questions in that they're looking for. And again, if we don't get to everything, there's some really great questions in here. Please feel free to reach out and I can definitely get those questions answered. Dean Shep, I was hoping you could talk a little bit about public health. That was a question that came up a few times. Can you talk a little bit about how public health is layered into Bouvé? And obviously it's such a hot topic right now. And what is the importance of learning about public health within the health sciences?
Absolutely. So public health is layered from the very beginning, everything from understanding how the patterns of disease work and what are the risk factors in courses like epidemiology, understanding social and environmental determinants of health. Those are courses that we offer, as well as community health and community and public health, so that we understand not only the person. And, when I was talking initially about personalized medicine, I talked about biology and lifestyle and environment. And that really is the approach that we take in our majors. Certainly, I would say all of them, but very specifically in the health sciences major, because as I said, it is accredited by the colleges of education in public health. And so there is a strong core of courses that take the student and the understanding all the way from risk factors and relationships to understanding how public health can happen in the community. What are the advices that we need to give? We've learned all of that now through the pandemic in terms of social distancing and washing hands and wearing the mask and all of those things that really refer to how the public at large, testing, vaccination, you name it, how the public at large responds to guidelines that allow not only the person and those close to the individual to be, or the patient, the client, to be healthy, but really everybody around anybody else, right? And that's why it's really about the community and all of the people. So there is that very strong foundation. The other piece that we have that is very important is a +1 program. So students that are interested in getting a master's in public health in the health sciences major, their last year in the major is the first year, could be the first year in the MPH program. And then in 5 years with a 4+1, which is what the +1 means, students will have a bachelor's and an MPH during their stay at Northeastern University, which is a pathway that many students choose. And I'm sure Lance advises many students that are in that pathway.
Yes, I do.
Yep. Definitely becoming more popular because of the pandemic as well. So it's a great opportunity that we offer at Northeastern, the +1 programs.
Perfect, thank you. I'm gonna have you close us out in a second, Joan Marie, but I just did want to mention there was a lot of questions about the combined majors. Also very unique to Northeastern. It's a really great way of taking 2 academic subject areas that are of interest to you and really combining the core of 2 programs. So it's not a double major. So it's a little bit different than other institutions and how they do it. You're really taking half of one major and half of another and really combining the 2 core with overlapping subject area. And it's a curated curriculum. So not all majors can do the combined, like nursing and pharmacy cannot, but health science is really popular to combine with other programs. So there was a lot of questions in there. Feel free to reach out again to me if any questions about that come up. Again, thank you so much for your time. In the last minutes that we have left, I would love it, Joan Marie, if you can share why you decided to come to Northeastern and what advice you'd have for the students who are looking in on this session right now.
Definitely take a second to congratulate yourself. This process is hard and you're getting to the end of it. And it's time to just be excited instead of stressed. I chose Northeastern because I loved the people here. I loved that people were busy because I wanted to be busy. Everyone's very into what they're doing and very passionate about the things that they do. And I really appreciated that. And that's what I was looking for in a school and co-op. Everyone says co-op. We would go around in circles and at the beginning and people would say, why did you choose Northeastern? And people would go, experiential learning, co-op, these types of things. So it's a very common question and answer. So a lot of reasons. The people and the experiences I think that we can get are the biggest reasons.
What is one thing that you've done at Northeastern or Bouvé that when you were in high school, you're like, I couldn't have imagined that I'd be doing this in 4 years?
I didn't ever think I would study abroad at all. So that was an incredible experience for me. And I didn't think I would be able to work nights. And I could. So that was another really great thing I learned. And I don't think I would have decided on PreMed if I hadn't had a co-op experience like that.
That's great. Well, thank you all so much. I hope everyone enjoys the rest of your Sunday. Again, really great questions. I'm sorry we weren't able to get to everyone, but definitely don't hesitate to reach out. I want to thank all my panelists. It's always great to hear different perspectives, and we hope to see you all on campus this year. Thank you all so much.
Great, thank you.
Bye-bye, everybody.
Bye,
Congratulations.
everybody. Yeah.
Congrats. Thanks.